Thank you, Julie.
Well, the new health care law weighing heavily on the minds of many voters, and now a new Fox News Opinion Dynamics poll shows just how divided Americans are on this issue. When asked, what would you like lawmakers to do with a health care law, 27% say repeal it entirely. Another 27% say only repeal parts of it. 19% of the voters say expand it. 17% say leave it alone.
Well, what is Congress planning to do then about the health care law? Republicans are making it clear they want to do away with it entirely, and, well, even some Democrats on the campaign trail are telling voters they would like to fix certain parts of the bill. So how will the election outcome affect what lawmakers do with it? Republican Congressman Brian Bilbray of California joins me, and also Democratic Congressman Elliot Engel of New York here in our studios joins us as well. All right, Congressman Engel, I want to ask you, if Democrats are even acknowledging, obviously many of them while they're campaigning, that there are several problems, some half a dozen of them, to say the least, with the new health care law, does this mean that the whole law needs to be gutted, or do we go back and rework some bad legislative points, and if so, which ones need a total do-over?
Well, the law certainly should not be repealed. The good things in the law, which I think many people can agree on, is insurance companies can no longer deny you coverage because they claim you have a pre-existing condition. They cannot deny you coverage because they say that you've reached the cap, the annual cap or the lifetime cap. And now we can keep our children till age 26 on our policy. So these are good things that no one, or at least not me, wants to see repealed. There are some things, as there are in every major big bill, that have to be tweaked and changed, and this bill is no different. We had it with the civil rights bills, we had it with Medicare and Medicaid, and we have to change some things in health care. The bill does not really kick in until 2014, and we have time to see what needs to be changed. Invariably, inevitably, there will be changes. I think we should keep the good parts and change some of the problematic parts.
We also have an election 16 days away, and Congressman Bilbray, I guess my question to you is, any fear among Republicans that Democrats are actually going to use their fix-it approach to help them win in November? I mean, it has worked at least once before when Democrat Mark Kritz rode to victory in the May special election to replace Democratic Pennsylvania Congressman John Murtha on the promise that he'd work to improve the bill rather than seek its repeal, even though he opposed it in the first place.
In fact, Julie, look, the entire process was flawed to the core. Process matters. When people aren't allowed to read them, the difference between then and now is people are finally starting to see the stuff in there that was just horrendous. So look, if the Democrats think that this bill has such good parts about it, then bring it out in the light of day, give the 3 days, give it 10 days, allow the public to read all of it, and then bring it back up for a vote. If it's got such great parts, then obviously the congressman and the speaker will be wanting to do it again in a proper manner. But when you do it the way it was done, where people weren't allowed to read it, it was the backroom deals, I mean, this thing was just really, I think even the Democrats across the board know they were asked to make a vote on faith and weren't given the time to read it. And now that they see it, they realize, my God, and the more the public reads it, the more the public's outrage. I think the real outrage ought to be that the product reflects the process. It was a back room. It was a locked-up process. No one was allowed to read it, not just the members of Congress, but the public.
Right.
So if there's such great parts about it, let's bring it forward and let's vote on it in the light of day.
A lot of Americans, Congressman Engel, are outraged because this was sold to them as health care reform, but many would actually argue this was instead health insurance reform. So the question is then, why should we trust Democrats to get it right a second time around? And why would they go and pass this legislation if even Democrats saw some half-dozen problems and flaws with it?
Well, Brian and I are good friends, but I absolutely disagree with him. This bill was not done in the back room. This wasn't done any more in the back room than any other major piece of legislation that was done when Republicans controlled the House for 12 long years. And we had Medicare Part D with the huge donut hole which hurt senior citizens, and none of us had a chance to change that. The fact of the matter is you need 60 votes to pass things.
But you got to read it. But you got to read it.
No, we read it. We read it. You've got 60.
Yeah, but you didn't get to read this health care bill.
I didn't. No, we read the health care bill. There were parts of the health care bill that some people had questioned. But, the Republicans have been distorting and lying about the bill so long that the American people are frightened, the so-called notion of Obamacare and saying it in a derogatory way. The fact is that my constituents who were denied who paid their premiums year in and year out and then got sick and then wanted to get health care coverage, who were told, sorry, now that you're sick, we're not covering you, or sorry, you have a pre-existing condition, or sorry,
you're talking insurance.
Well, whether it's insurance or whether it's health care reform, they go hand in hand. The fact of the matter is that there are things that needed to be fixed. We attempted to fix them. There are certain parts which hurt senior citizens, and none of us had a chance to change that. The fact of the matter is you need 60 votes to pass things. But you got to read it. But you got to read it. No, we read it. We read it. You've got 60.
Yeah, but you didn't get to read this health care bill.
I didn't. No, we read the health care bill. There were parts of the health care bill that some people had questioned. But, you know, the Republicans have been distorting and lying about the bill so long that the American people are frightened, this so-called notion of Obamacare and saying it in a derogatory way. The fact is that my constituents who were denied, who paid their premiums year in and year out and then got sick and then wanted to get health care coverage, who were told, sorry, now that you're sick, we're not covering you, or sorry, you have a pre-existing condition, or sorry,
you're talking insurance.
Well, whether it's insurance or whether it's health care reform, they go hand in hand. The fact of the matter is that there are things that needed to be fixed. We attempted to fix them. There are certain parts that are coming out that needed to be changed, and the Republicans got to not just say no. The Republicans, as they've done, the Republicans have got to be in there working with us, and we'll fix it.
Very much like when this bill was passed, Republicans felt like they couldn't get a word in edgewise, sort of like this interview. Now, I want to just give Congressman Bilbray a final thought here. You know, Democrats were accused of not letting Republicans have much say when they passed this bill the first go-round. So how much will reforming this law depend on who controls the House and or the Senate next year?
Julie, I think it's absolutely critical, and you're hearing Democrats across the country say we voted for it and weren't allowed to read it. We were told to vote for it. You could have allowed cross-state purchase of insurance. Wasn't considered. The tort reform wasn't in there. The fact is, all of this packaging went over there. This is not health care. We've got a crisis in health care, and it's not one of mandating that people buy insurance. It's one of having access to a doctor within the next decade. But that's totally not being talked about because there was an agenda. What really happened with this health care issue is we had a financial crisis, and the leadership in the Democratic Party wanted to exploit it to move an agenda that wasn't directly related to the health care crisis. Instead of creating jobs, they created a whole new
entitlement that they don't know how to pay for. Republicans have got to stop just saying no to everything. If the Republican Party would be constructive, we could put our heads together and come up with a law, but you guys decided you were going to vote no and then not tell the truth about the bill.
Congressman, the bipartisan effort was a no vote. It was bipartisan opposing this backroom deal, and now the politics is coming back to roost. Allow the people to see it before you vote on it next time.
American people need health care reform and want health care reform, and the Republican Party
they need open government,
should stop standing on the sidelines.
Well, hey.
And when you guys controlled Congress for 6 years with President Bush, we didn't see open government. We saw deficits as high as the eye could see.
You said that you would change the system, and what you've done is made it more closed than we've ever seen it in this republic.
Well, you know, the good news is they are going to read it around this time around. That's a good thing.
We read it the last time around, believe me.
I don't know if everybody
did. That's not what a lot of Democrats
even the civil rights bill. Well, I read it. I'm on the committee that passed it.
Did you read the tax on medical implants? Did you read that tax on medical devices?
I read the entire bill. When you passed, I think you probably voted for it, Brian. When you passed a Medicare Part D with the donut hole.
I wasn't there.
Seniors.
I didn't vote for that bill.
Okay, but your party did, and it was done in a closed session and voted on at 5 a.m. in the morning.
You talked to your medical device business.
Gentlemen,
for 4 hours.
All right, thank you for a fair and balanced debate. I wish I had another hour.
Next time, ladders be open.
Congressman Bilbray, Congressman Engel, thank you, gentlemen, very much.
Thank you.
Well, 16 days to decide. It may take them another 16 days to wrap up that interview. But Fox News is your front row seat to politics. You can log on to foxnews.com for all your national election coverage. Get nonstop updates from our in-the-field reporters and producers. You can read the stories you'll only see on Fox News. Click on to the following link, Fox